There we go. Good morning. Everyone can see and hear. Yes? Okay, great. If anything changes, send up a flare because it's not raining that hard right now, but we are supposed to have quite the deluge, and I'm plugged in. It should be fine, but just keep me posted. Okay, welcome everybody. I love teaching this class. It's just I think it's really such an important thing, maybe the most foundational additional knowledge that acupuncturists who are treating patients going through ART need to have, because I know I've mentioned this many times over the last couple of months that we've been um, studying together, but the the biggest faux pas acupuncturists make is a failure to refer. The biggest mistake is thinking that Chinese medicine is enough for patients who are struggling to conceive over a period of time, because there is a real window here, right? I mean, if I really look at it in the same way that you would look at an oncology practice. If you saw signs and symptoms in a patient that they might have cancer, would you be like, just work with me for a couple months? It's cool. We'll see what happens next. No, you wouldn't. And so there are certain points in time when it is not appropriate to say to a patient, just work with me. We don't need more information yet about what's happening, or you don't need advanced care from Western medicine. So being truly a fertility acupuncture specialist or TCM fertility specialist requires a real understanding of when Western intervention is necessary and what Western intervention is. I jokingly, though there's a grain of truth in this joke, frequently say to my patients, I'm the RE police. Think of me as the person who is going to be paying very close attention to what's happening at the clinic you're working with. And if I don't like how it looks, I'm going to recommend a second opinion. And unfortunately, at least in California or in Los Angeles, where I live, there's a real imbalance in reproductive endocrinology care. There are patients who are pushed very quickly into IVF cycles when they needed more diagnostics. And there are patients who get stuck in a diagnostic loop and need more intervention. And as the person who is kind of a neutral player, but has had patients who've come from every clinic in my community, because I understand ART very well, I start to see where certain clinics kind of fall down and fail to do proper diagnostics, or where they push patients too quickly into IVF. So this is a reason why it's so critical that you understand these procedures, because for whatever reason, and we'll talk about this as we go, as acupuncturists, because once you have that real foundational understanding of the Eastern and the Western um, protocols for patients going through this process, you kind of become the team captain in a certain way. And so they really need you to know what's up, not just on the Western front, but also with whatever care they're receiving in the holistic or the wellness community. So today we're going to learn about navigating the fertility care provider landscape and feeling confident about that, understanding roles and responsibility of different fertility specialists, and knowing when to refer patients from either to their obstetrician gynecologist, or from their obstetrician gynecologist to an REI or whatever other type of specialist you think they need to see. We're going to learn how to interpret fertility diagnostic tests and lab values and make sure that we're at a place of having proficiency in understanding hormone panels, imaging, other key diagnostic markers. And we're going to understand ART procedures, medications, and protocols. Of course, there are going to be protocols that you'll see that go beyond today's scope, but this isn't, or this lecture, but it's designed to give you an overview of what you would be expecting to see. If those of you in the mentorship were not at our little watch party last week, I invite you to go back and take a look at that from Dr. Corinne Chung. And there are another bunch of experts who are talking about IVF specifically as well when it comes to like specific protocols. And we're going to be talking about collaborating effectively with multidisciplinary care teams. What are the best practices for communication and integration with conventional medicine providers? Because that is also the key. I think that as acupuncturists, we often come into our expertise or our field of specialty feeling really intimidated by our Western medicine counterparts, feeling like we don't have the chops to collaborate with them, or feeling like it wouldn't be, it would be weird and we're not going to send an email or a note about a referral or something that's going on. And that is the fundamental thing that also really needs to shift. That's an internal shift. That's deciding like, I do know enough, I am worthy. I am an expert in my own right, and I want to communicate with this doctor because that's what's best for the patient. So learning how to collaborate, not being shy about collaborating, getting to a place where you're confident and comfortable to reach out to other practitioners is a way to grow your expertise. It's a way to grow your practice, and it's also a way to develop trust with your patients. So we're going to be here for about 3 hours. We're going to talk about the fertility care team. I don't know how long these things are really going to take, but this is my estimate. Now we're going to talk about building a network of collaborative providers. We're going to talk about diagnostics, interpreting tests and lab values. And then we're going to talk about ART procedures and protocols and understanding what medical interventions are and what your role is in that. When we do our final module in a couple of weeks, it will be all about how we're going to incorporate our treatments into this process. Today, we're going to be much more focused on the process itself. So the first thing is about building your fertility care network, right? We're going to look at what are fertility care providers? What is each of their scopes? Sometimes there's a bit of confusion around that, around what is the scope of a fertility care provider. And how do we navigate referrals to who? When should we be referring? And what are the limitations of each provider? So there's kind of a spectrum here, right? We have our reproductive endocrinologists are going to be at the base of this pyramid. They are the advanced fertility diagnostic providers. They're the ones who provide treatment. They provide sometimes, some surgical procedures where they refer out for surgery. After that, we have the OBGYN. They're for reproductive health guidance, and they have some limited scope when it comes to ART, or essentially just IUI is kind of where their scope ends, and we'll talk about that a little bit more. Then we have primary care providers, and they're often the ones providing initial assessments and referrals or blood work. It's very common that I'm sending a patient to their PCP with a list of blood work that I want to see, and that we will then pass on down the pyramid. So knowing what that blood work is oftentimes the gateway to getting them additional care. And then support specialists like ourselves, complementary care providers providing holistic support, which can be range, as we'll see, anywhere from acupuncture to pelvic floor physical therapy and a variety of other things. So it's important to know where each care provider fits into the spectrum. And as I've said before, the biggest mistake I see is when support specialists put themselves here at the bottom of the pyramid and think that they are the baseline for treatment. It's a really big mistake and can cost someone their fertility. So let's start with the OBGYN scope of practice. I think in a lot of communities that are significantly smaller than my own, we see OBGYNs extending their care in the infertility realm. Not to say that it doesn't happen in big cities, it certainly does, but it's a bit easier to refer somebody to a fertility specialist when there's an abundance of them. In smaller communities, it may be a long distance to drive to see a fertility specialist. And so oftentimes OBs will kind of push their scope, but there are some real issues around that we'll get into here. So the role of the OBGYN primarily is preventive care. They offer pap smears, hormone panels, and general reproductive health. They should be able to offer a basic fertility workup, including initial hormone testing and cycle monitoring. But you need to be an additional set of eyes on that, because the primary job of an OBGYN in most communities is to deliver babies and to serve patients who are already pregnant going through prenatal care. And that's a specific kind of office setup. A fertility office setup is quite different. Pardon me. And one of the key differences is the ability to see patients who are going through cycles 7 days a week. Obstetric offices typically don't have provide appointments on Saturdays and Sundays. So if somebody needs to have an IUI on a Sunday, they may be out of luck and waiting until Monday, and the opportunity has already passed. That's one of the ways where we see IUI is getting kind of screwed up in the obstetric environment. It's literally a matter of timing, but patients are not always informed that it's no big deal to come in a day later. They just kind of keep the process going, and it can really delay the outcome the patient's seeking, which is to be pregnant with a healthy pregnancy. IUIs in obstetric care can be provided in one of two ways. One is just a natural cycle IUI, where they're really not offering any medication. They may be monitoring. They're having the patient monitor themselves for an LH surge, and then they're coming in for an IUI the following day. Or they can prescribe a very limited number of medications, specifically Clomid and Letrozole. It is not in the scope of an OBGYN to provide gonadotropins, injectable medications. So they're very limited. It's only these medications, which we'll discuss, that are creating an increase in internal hormone production. It's not exogenous FSH that you see with the injectable gonadotropic medications. So again, that's very limited, and those medications are not optimal for every patient. So understanding which patients might do better with medications that are allowed in an OB office versus the ones who really need that more intensive stimulation is another place where you may become the primary referral source or the primary recommender of moving on to an REI office. And then OBGYNs provide preconception counseling, but it is a limited scope, again, compared to reproductive specialists, meaning reproductive specialists are providing genetic counseling and looking at more complex situations within a couple who are trying to have a child, but they are obviously providing basic preconception counseling.